My name is Amr Azim. I'm a reproductive endocrinologist at New York City IVF. If you were diagnosed with polycystic ovarian disease or polycystic ovary syndrome and interested in getting pregnant, there are probably a few things to consider. Polycystic ovary means higher concentration or density of small follicles in the ovary. In itself is a good thing. You have many eggs. But sometimes, for unknown reason, this will interfere with ovulation so that you do not mature one of the big number of eggs that you have into an egg that can ovulate. And because of that, estrogen does not increase and build the lining. And because of that, sometimes the period is delayed. And you might miss your period for a few months. The male hormone is also at a higher concentration because it's produced from the large number of follicles. And sometimes you'd have manifestations of increased male hormone like hirsutism. Sometimes women with polycystic ovary are overweight, and that also interferes with ovulation. In the absence of other fertility factors, as a tubal factor or male factor, usually many women with polycystic ovary can be helped with simple treatments. The mainstay of treatment is to use oral medications, and there is a clomiphene citrate, a medicine that was there for a very long time, and more recently another group of medication called aromatase inhibitors, notably letrozole, can be used alternatively for that purpose and yields very good success rate. These medications enables you to mature your egg and to ovulate. They work in a different mechanisms. They are generally safe and they have been used for quite a long time for now in case of Clomid, and a long time in case of letrozole. And there is no evidence that they are associated with an increased risk of anomalies. And they are oral and usually produce one egg, so the risk of multiple pregnancy from these medications is not that high. It's about 8% per cycle, and the majority of the multiple pregnancies are twins. It should be, though, monitored to avoid and further minimize the risk of multiple pregnancy, because some women are sensitive to these medications. So it should be monitored by a person that is well versed in monitoring ovulation using ultrasound and bloodwork. If in some women clomiphene citrate or letrozole does not lead to ovulation, about 10 to 20% of women are resistant to these medications. And in this case, one option would be to use injection medications like gonadotropins that are usually successful in affecting ovulation. And the issue is that women with polycystic ovaries are sensitive to these medications, so they might produce many eggs after injection with gonadotropins. Certainly, these medications should be monitored by reproductive endocrinologists to minimize the risk of multiple pregnancy. The risk of multiple pregnancy using injection medications and then insemination, although it's a simple treatment, is about 30% for twins and about 1 to 3% for triplets. And because of that, they have to be used with extreme caution in women with polycystic ovaries. Another alternative treatment is to stimulate the ovary, retrieve all the eggs out, fertilize them in the lab, and transfer only one embryo, so that the risk of multiple pregnancy is minimized to less than 1%. And this treatment appears to be safer for the long-term baby outcomes when compared to gonadotropins or injectable medications and intrauterine insemination. It also has a much higher success rate, and it also carries the potential that the excess embryos are frozen and can be used for subsequent cycles or subsequent babies.